and estimated expenditures for departments of the City and County of San Francisco as of June 1st, 2022. Item 2 is the annual salary ordinance enumerating positions in the annual budget and appropriation ordinance, continuing, creating, or establishing these positions, enumerating and including therein all positions created by charter or state law for which compensation paid from the city and county funds and appropriated in the annual appropriation ordinance, authorizing appointments or continuation of appointments thereto, specifying and fixing compensations and work schedules thereof, and authorizing appointments to temporary positions and fixing compensations therefore. Members of the public who wish to provide public comment on these items eventually should call 415-655-001. Meeting ID is 2487-533-8802. Then press pound twice. If you haven't already done so, dial *3 to line up to speak. The system prompt will indicate you have raised your hand. Please wait until the system indicates you have been unmuted, and you may begin your comments. Madam Chair.
Thank you so much. And I, unlike yesterday when I messed up, wanted to see if the Budget Director, Ashley Grafenberger, had anything to say before we begin.
No, Madam Chair, no opening comments. Thanks.
Okay, thank you. In that case, Mr. Clerk, can you please also read items 3 and 4?
Yes, items 3 and 4. Item 3 is an ordinance amending the health code to set patient rates and rates for other services provided by the Department of Public Health for fiscal years 2022 and 2023, and 2023 and 2024. Item 4 is a resolution authorizing the acceptance and expenditure of state grant funds by the San Francisco Department of Public Health for fiscal year 2022 through 2023. Members of the public who wish to provide a public comment on these items should call 415-655-0001. The meeting ID is 2487-533-8802. Then press pound twice. If you haven't already done so, dial *3, line up to speak. The system prompt will indicate you have raised your hand. Please wait until the system indicates you have been unmuted and you may begin your comments. Madam Chair.
Thank you. And we have the Director of the Department of Public Health who's going to start us off today. And you can go ahead and either start with items 3 and 4 or have your staff start with items 3 or 4 and get those out of the way, or you can start with your budget presentation, whatever you prefer.
Good morning, Chair Ronan, President Walton, committee members Chan and Marr, Grant Colfax, Director of Health. It's a pleasure to be here. We'd like to start with the budget presentation and then move on to the other items. So,
sounds good.
Great, thank you. So first of all, I want to say it's wonderful to be back in these chambers and to see you all in person. We've had 2 years of, I think it was Zoom meetings, not team meetings, when we were going through the budget process. And it's really emblematic of how far we've come in San Francisco with regard to the ongoing COVID pandemic. I want to thank you for your ongoing support of health and wellness, supporting health and wellness, advocating for health and wellness in San Francisco. And Chair Ronan, it was 3 years ago where the mental health SF piece really came into focus, and I want to thank you for your leadership and support in that regard. I also want to thank the Mayor's Office and Mayor Breed for supporting our departmental budget, and thank Ashley Grafenberger and her team for an amazing amount of work in collaboration with the DPH leadership team. You know, the pandemic has only reinforced the importance of public, the COVID pandemic has only reinforced the importance of public health in our country and locally. And I would say that right now, the public health department, our public health team, is tired, but resilient, concerned, and also hopeful about what may lie ahead. And most of all, we're firmly committed to doing what's right for the people of San Francisco and ensuring that health and wellness continue to be a priority. In terms of our overview, could we have the first slide, please? We'll provide an organizational and budget overview. We will talk about key initiatives in the upcoming budget, and then staffing and vacancies. Next slide. Next slide, please. So our mission and vision as a department is to protect and promote the health and well-being of all in San Francisco. Our vision is ambitious, which is to make San Francisco the healthiest place on earth. And as you know, the department is large and we do a lot. We assess and research the health of the community. We develop and enforce health policy. We do everything we can to prevent disease and injury because we know prevention is so key. We educate the public and train healthcare providers to respond. We provide quality, comprehensive, and culturally proficient health services, and we ensure equitable access for all. We are the safety net health system for San Francisco. Next slide. You see we are a large department, but we're also an integrated department. And I would point to the health network, the behavioral health, operations, and population health components of the department. Unlike many health departments across the country, we have our healthcare system, our delivery system, our behavioral health system, and our population health systems all under one roof, so to speak, one collective roof. And I think that this is an extreme strength of the department. And we saw that during COVID-19, and we continue to see this as we respond to other health concerns and issues. Next slide. Our budget this year is $3 billion for both the 2 years. And you can see on this pie chart how the budget is distributed. As you know, healthcare in this country is extremely expensive, particularly in what we call the acute care settings, the hospital settings. Zuckerberg San Francisco General, the only level 1 trauma center in the city, is 38% of our budget. Behavioral health, a key priority of the mayor and I know of the board, represents 20% of our services. Our primary care and health network services follow, and then Laguna Honda Hospital, our skilled nursing facility, is 11%. You can see our FTEs under the divisions here. We have a total of 7,815 FTEs. The budget represents an increase of 6% compared to the current year, but remains flat over the 2 years of this budgeting. And I think really one very important thing to point out is that DPH leverages over 2/3 of revenues and receives 1/3 of our budget through general funds. And the biggest funder of those revenues is Medicaid and Medicare. And next slide, please. In our approach for the 22-24 budget, it balances investments between major multi-year strategic priorities and department operations and programmatic support. Our major areas of investment include continuing the COVID-19 pandemic response, investing in public health infrastructure that's very closely tied to our pandemic response, but also exemplifies the need to continue to respond to ongoing infectious diseases. For instance, we saw our HIV numbers worsen in terms of viral control during the pandemic. Syphilis continues to be a major issue and is actually increasing across the country. And then we have additional emerging infectious diseases, not only concerns about COVID-19 variants, but I think you're all aware of the monkeypox cases that are being reported and that our department is addressing aggressively. We're also improving access to the behavioral health system of care, and our behavioral health director, Dr. Cunnins, is here to get into more details on that later today. Increasing access and creating sustainable staffing at the San Francisco Health Network. This is especially important in strengthening our nursing staffing patterns. Continuing workforce and health equity, and strengthening hiring, retention, and contracting. You know, the pandemic has created a shortage of healthcare providers, both direct clinical services and in public health. So being able to hire and also retain is incredibly challenging right now, and our budget reflects the need to strengthen those parts of the department. And you have heard, I think, both during the pandemic and even before the pandemic, the challenges that we have had in efficiently moving contracts through the system to put services in the hands of our community-based organizations. And this budget does everything it can to strengthen that work, to ensure that services get to people when they need them, and to decrease the odds that you will be seeing delayed contracts or retroactive approval of contracts in the future. We know that this has been a problem. It's only become more challenging during these pandemic times. So I thank you for your support. Look forward to hearing your questions. And I'll now turn this over to our Budget Director and Chief Financial Officer, Jenny Louie. Thank you.
Good morning. Through the chair, Jenny Lee, Chief Financial Officer. I'm pleased to go through some of the major strategic initiatives we have, and we are joined by DPH leadership who can go into more detail if you have further questions. First, next slide, please. So first, with our COVID-19 response,
the submittal of the grant application. Members of public who wish to provide public comment on this resolution may line up to speak. Once we call public comment, or if you are joining remotely, please call the public comment line of 415-655-0001. Enter the meeting ID 2485-887-9674, then press pound twice. Once connected to the meeting, you will press *3 to enter the speaker line. A system will indicate that you have raised your hand. Please wait until we take public comment on this item, and the system indicates you have been unmuted. That will be your cue to begin your comments. Mr. Chair.
Thank you, Madam Clerk, and thank you, Supervisor Mandelman, for bringing this item forward. And as the sponsor of the item, the floor is yours.
Thank you, Mr. Chair. The item is to accept state funding for a project in the heart of District 8, the memorial at Harvey Milk Plaza, which is the plaza at the Castro Muni Station. The Friends of Harvey Milk Plaza has developed a vision for a redesigned plaza that adds more community gathering space and also serves to better celebrate the history of Harvey Milk and the LGBTQ rights movement, while including a number of safety and accessibility improvements as well. The project is currently in the capital plan as an emerging project under DPW and is expected to use a mix of private, state, federal, and local funding. It has been endorsed by the Arts Commission. The project has received city funding in the past, $550,000 over the past 3 years' budgets to fund DPW project management and CEQA review, as well as $1 million in state funding in 2017 that was used to begin the design and outreach process. The item before us today is this accept and expend for a state grant of $1.5 million to Public Works that Senator Wiener secured in last year's state budget. And the purpose is to get the project designed to 100% construction drawings and fund related soft costs at DPW and Friends of Harvey Milk Plaza to coordinate development of the final plans. And I think we are joined, I'm going to say remotely, by Jamoke Akins-Taylor from Public Works, who can respond to any questions. And I would recommend that we pass this out with positive recommendation. Thank you.
Thank you. And do we have a presentation from Public Works on this item?
Presentation, maybe
good
just. Good
morning. This is Jumoke Akins-Taylor. I believe there isn't any additional comments to what the supervisor has already stated. This is an application from the State's Arts Council, and we received the notice to apply for this grant in November 15, 2021, and this would, as he mentioned, this would complete the design for the Harvey Milk Plaza and cover some of the soft costs in managing this project. So I'll be here to answer any questions that you have.
Thank you, Ms. Akins-Taylor, and I would like to be added as a co-sponsor to this item, and then if there are no other comments or questions, let's open up public comment.
Thank you, Mr. Chair. Members of the public who wish to speak on this item and are joining us in person should line up to speak now. And for those joining us remotely, please call 415-655-0001. Enter the meeting ID 2485-887-9673, then press pound twice. Once connected, press *3 to enter the speaker line. For those already in the queue, please wait until the system indicates you have been.
That $7.9 million. This bundles a lot of really small functions within our task force functions. It does include rent to house these functions at 101 New Montgomery, as well as information and guidance out to the public, logistics and operating functions such as finance and cost reporting, particularly through FEMA, as well as HR and supply management. Moving to the next slide, looking at the health network. There is additional staffing required to run our hospitals in a post-pandemic world. And so we have increased staffing at Zuckerberg San Francisco General to maintain access and nurse ratios, occupational health clinic, monoclonal antibody clinic, and a testing site for DH staff and network patients. At Laguna, we're focusing on the areas of outbreak management, infection control, testing for patients and staff, as well as security and enhanced sanitation protocols. In primary care, increased staff to support vaccinations and increased staffing for call center support. Moving over to behavioral health. The mayor's budget continues the implementation of prior year initiatives, including Prop C, but we have additional investment to complement the continuing initiatives from prior years and address unmet needs. That includes $2 million to strengthen services for clients on involuntary 5150 holds, including San Francisco General Psych Emergency Services, and $3.2 million for comprehensive crisis services for crisis line and bereavement, about $1 million to expand access in our adult and older adult outpatient clinics, $700,000 for our Children's Center of Excellence, which provides subspecialty care for our network clients, $1.6 million to create a residential office that will manage our residential system of care, recognizing the significant investments that we have in beds coming online over this current year as well as upcoming 2-year budget. $1.8 million in utilization management to ensure our clients are being served at the appropriate level and have access to care. $3 million in overdose response, and $10.6 million from the Tenderloin Center, funded by one-time Prop C, to continue operations at the current center through December of this year. Next slide. In addition, as Dr. Colfax said, we are investing in DPH operations for the reasons he mentioned earlier. $4.2 million in our population health infrastructure, as well as $2.6 specifically for a public health emergency and preparedness, and $3 million to expand our HIV prevention and getting to zero initiatives that we have already in the base. In terms of DPH operations, we have $6.3 million to support DPH contracts, communications, and supply chain and facilities functions, as well as $4.8 million to really invest in our human resources and health and workforce equity programs. Jumping over to the health network. We have in ambulatory care, $1.2 million in jail health services to support reentry services, expanding our dosage of buprenorphine for new patients and quality improvement. We also have an expansion of dental services, health at home, and maternal child health services. At Laguna Honda, we have $2.2 million to increase clinical coordination, as well as $700,000 to expand our behavioral health emergency response and patient safety. And at Zuckerberg San Francisco General, we are increasing staffing and clinical support and the census at San Francisco General, expanding specialty services and cardiac impella and building and safety. So before I just leave our budget, I will also just want to note that in addition to the proposed expenditures we have before you, the department did load about $145 million of additional revenue in the first year and $110 in the second year of the budget, which offsets the cost of these proposals and a little bit of our ongoing increases as inflationary increases projected in the deficit. Switching over to vacancies and staffing, I want to thank the Controller's Office for developing a really great rubric and robust reports for us to be able to discuss positions. DPH budget salary savings to recognize routine and temporary savings between employee separation and a new hire. An average rate of 8.8% across the entire department. We have lower levels at the hospital due to the fact they are 24/7 facilities, and so we cannot allow for positions to go empty for longer, and so we do backfill with temporary P103 and overtime as necessary. Our regular operating budgets have an average of about 12% attrition across those divisions. And again, positions are not held intentionally to achieve savings. Next slide. So using the controller's report that I mentioned before, and this is slightly complicated, but the first section here represents our total filled positions, our total authorized positions after recognizing salary savings. The second section shows the filled positions and then the vacant. And so for the department in the current year, we are averaging about 5% vacancy in the current year, which is slightly higher than the prior years that you've seen before.
That means temporary exempt.
Moving to the next slide, we have the top 10 classifications are primarily in the health classes, which is predominantly what we have. And these top 10 areas where we have the most vacancies compared to budget represents almost 300 of our vacancies. And then the next—
Is that the total number? 304 is the total number of vacancies in your department?
Now, per the controller's report, we have ability to have 350 additional hires to remain within our budget authority, and that's on slide 17. And then I was just highlighting, because there's a lot going on in these reports, I was highlighting the top 10 that we have, in top 10 job classes where we have the largest number of vacancies. In terms of where these vacancies were most last occupied, this chart shows that predominantly about 87% have been vacated in the last 3 years. We are working with the budget and legislative analysts to analyze this data and determine what might be available for a reduction. And with that, I will just turn it over to Luana Kim, our Human Resources Director, to talk about some of our work that we've been doing in human resources.
Committee members, before I ask the one, I know that we're tight on time and you're trying to move, so we can definitely give that presentation if time allows, but I wanted to check in because it sounds like you're trying to move through the day, but we have some slides on improvements that we're making to our hiring process and our human resources system, so we'll defer to the committee.
This is a really important part of the presentation. Can you just go fast?
Yes.
Good morning. Thank you so much for your time. Through the chair, my name is Luana Kim, and I'm the Human Resources Director. I'm honored to be the HR Director for the Department of Public Health. Thank you for giving me a few moments. I will try to gallop through the slides and leave time for questions. I am joined by our staffing manager, Karen Hill, who has been doing heroic work in filling the vacancies. And I know that she recruits all the time, and she's probably going to be recruiting during the Warriors game as well and trying to find folks. So this is a particularly timely conversation because we just came out of bargaining. I was at the RN table for most of the sessions, but I attended others as well. And I was really fortunate to be able to hear firsthand from staff about all the challenges that they've been facing. And it was just a very moving time and a really important time. And they talked about the lack of staff and the need to fill vacancies. So I thank you for having this conversation and discussing it. We have made some progress, but we recognize that we have a ways to go. And with that, I'm going to just share some of the things that we're doing. Next slide. There have been several external and internal factors that have remained challenging in filling our vacancies. Externally, there is a national workforce shortage where we are all competing for the same healthcare talent. Internally, with HR staff, systems, and resources, we just unfortunately have not been able to keep up with demand. We don't have enough staff, and our processes at this point are manual and they're labor intensive, which just takes time. Next slide. Despite the challenges, we have had some accomplishments. We've hired over 700 staff in 6 months, and we have 359 in the pipeline in the interview process. We have expedited the hiring processes whenever possible. We have participated and held over 6 recruitment and onboarding events since April. SEIU represents over 80% of all DPH staff. We have met and will continue to meet with them monthly to find ways to maintain fairness and equity in our hiring processes, but also streamline the process. We have already had some successes in working with them and will continue to do so. We have over 25 classifications that are in continuous recruitment, so we're recruiting all the time, and we will add more classifications over the next year. And we've produced some recruitment videos to help with this. We have been meeting with SEIU, DHR, and others over the past year to create career ladders, which are an important part of the process. Next strategy is to fill vacancies. We have a twofold strategy. One involves recruitment, so we can bring in more qualified candidates to our jobs. And the second is to increase the support and services that we offer to our existing staff who have demonstrated their commitment to our mission, and we need to retain them. For recruitment, we will critically evaluate our processes. We have way too many of them and way too many steps. We need to add resources and build and design systems. This includes eliminating or combining steps, recruiting and hiring continuously, and focus on filling our positions once permanently rather than temporarily and then filling them permanently. We need to add staff. We need an HR system to automate our tasks, and we need to reorganize the way we hire to make it efficient and, frankly, more modern. Next slide. For retention, we really need to work on improving the work culture for our existing staff in order to retain them, and we need to address pay equity. This includes, we've created an Office of Employee Experience to really focus on the experience of our employees. and see it from that way, that perspective. We are developing an academy for our supervisors because we know that that's where inclusivity and belonging happens at the supervisor level. And we need to provide sufficient staff to respond to EEO complaints and address requests for leave. As Dr. Colfax had said, our staff are exhausted and they're tired. They have had to work frontline dealing with the traumatic effects of COVID-19 while also dealing with themselves. So we need staff to be able to support them. We will continue to partner with the unions, educational institutions, and DHR to develop and expand promotive pathways for our staff so that they stay with us and they work and build their careers with us. For instance, we've had interesting conversations with SEIU where they've asked us to put a pathway for food service workers to become chefs, which is a really great opportunity. We have dedicated staff specifically to internal workforce initiatives, and we provide one-on-one career coaching and other services. So as we have wrapped up negotiations, we will continue to work with labor partners to look for ways to streamline our processes, like collapsing our classifications. We have way too many of them. There are 4 or 5 different, if you're a social worker, there are 4 or 5 different recruitments that you have to apply for just to be a social worker. We have to broaden our minimum qualifications are too technical. We have to simplify our assessment process, and our exam processes are too long, and many others. But in the interest of time, I will not go into those. I just want to thank Dr. Colfax and Mr. Wagner and the union partners for their support as we do this important work. I believe this concludes our presentation, and so we are available for questions. Thank you so very much.
Ms. Chan, I just have to say, I have been following DPH's hiring process extremely closely for the last 4 years. This is like the happiest. That was an amazing presentation. I can't even believe the turnaround that's happened. It's like 100% full turnaround. Thank you so much for your work. That is concrete, specific. It feels like it's going to work. You've shown that it works, and it's the first coherent staffing plan I've heard from DPH since I've been a supervisor. So thank you.
Thank you, and thank you so much for your support, Supervisor. I know you were instrumental in helping us in filling our position, so I thank you so very much, and for other supervisors as well. Thank you.
Thank you. Supervisor Safai?
Thank you. Thank you, Chair. Thank you again, Ms. Chan. That's great news on the aspects of hiring, and really want to thank all the hard work that was put in. I know we're going to have a special meeting next week to ratify the nursing contract. I hear the vote was 45% turnout last night of the number of nurses, and it was an overwhelming support. So that's tremendous work. I know there's been a lot of dissatisfaction and feeling of being overstretched, overworked, underappreciated. So hopefully this will be a big step forward, and really appreciate all your hard work on that. And as Supervisor Ronan said, the hiring process and the pathways for advancement are truly important for those in organized labor. So I've heard the same thing over and over again. So thank you so much for putting that additional work in. I have a number of questions today. I'm going to start with just building off of our hearing the other day on PRC Baker Places and the $3 million that you all found. We reduced the contract amount from $3 million to $1.2 million. So at first I want to confirm that the difference is available for a reappropriation on our list.
I'm sorry, can you repeat the question?
So you found $3 million for Baker Places. We reduced that amount from $3 million to 1.2.
Yeah.
Yes. We're looking for every single stone to unturn for additional resources. So want to confirm that we can use that additional 1.8 million for the difference for a reappropriation on our list here at the board.
I'll let Greg Wagner answer that question. Thank you.
And before you answer that, Greg, you can. So can you describe how you found the $3 million? And my understanding, it was from unspent contract amounts. So how often does this happen, and what's the projection of unspent contract amounts across all contractors that we're wrapping up for this year? That would also provide us with a list of additional monies potentially.
Thank you, through the chair, Supervisor Safai, Greg Wagner, Chief Operating Officer. So we will certainly work with the budget and legislative analyst on specifically your question about the Baker Places. We, each year, working with the budget analyst, go through contract balances and available funding.
Right.
In terms of your larger question about contract dollars available, I did not bring with me our third quarter projections, but each year as we go through the 6-month and 9-month projections for the Controller's Office and the Health Commission, we forecast the available or unavailable balance in each of our major categories, including contracts.
Right.
So we can certainly supply that number in its current state to the committee.
That would be great.
And the number does vary from year to year because in addition to our annual spending, we have cost report settlements, audit settlements that occur each year from various funders, which affects our encumbrances and our balances. So some years when we have paybacks, we're overspent and we have to move funds from other places to cover those. In other years, if we have favorable settlements, we have balance available, and that is the case in the current year that indicated to us that we had some wiggle room to adjust and
Great.
work
So that's what I would like the BLA to look at with your department, favorable settlements, any unspent contract amounts similar to this remaining balance. It would be really helpful so that we can get a full accounting of monies that would be available for us to make our final decisions. Thank you.
Thank you.
Next, I wanted to discuss the COVID task force. During our briefing, it was conveyed to us that it was $7.9 million for that project. And I understand that it's located in a downtown office space at 101 Montgomery. Is that correct? New Montgomery. How specifically are you all paying for that rent? And is the lease already agreed to? And is there a less expensive location potentially? And how many leases do you all have that potentially could be reviewed between now and next week? That's another thing we might want to look. Not all of them BLA, but this one in particular, I was a little surprised to find out that this was in a downtown office.
Again, Mr. Wagner can address this. Thank you.
Say that again? Oh,
Mr. Wagner will address
Got
the
it.
specific question about real estate
yeah.
and office
Thank
costs.
you.
Thank you.
Thank you, Supervisor. Good question again. So the location that you're referring to is 101 New Montgomery. That is actually a building that is leased by the Department of Child Support Services.
Oh, okay.
That has a longer-term lease. They scaled back and asked around through the real estate department for other city departments. We jumped on it because it's a favorable
Got it.
lease.
Okay, that's
it's very
straightforward.
cost-effective.
Thank you. That's good. And then on this, I might not have presented this slide today, but it definitely was presented in our briefing. It was the one-time Prop C funding. Did you show that slide earlier? Okay. So I saw a 10% reserve, $16 million. Again, we're looking for however many places we can allocate resources now based on demand and need. Not sure putting money into a reserve into year 2. I mean, it feels like when we have conversation with the mayor's office, they're often like, well, this is funded in this year. We can come back and have that conversation next year. So we're at a real significant deficit. So I'm wondering what the real justification is for that, and couldn't we appropriate that money in the current year to critical behavioral health needs today?
Thank you for the question. So yes, because Proposition C is a special revenue fund that has a single source and vulnerable to fluctuations, as we've seen in the current year, we put in a 2-year reserve to ensure that we are able to continue services. One of the things that did give us caution is that we had preliminary estimates by the Controller's Office in December or January, and over the course of the year, the number actually lowered in terms of revenue projections for both the current year and the 2-year budget. And so to ensure, because we had one-time savings, we put in a reserve to reserve against 10% of those funds to ensure continuity of services. They are already appropriated, but the spending plan could be adjusted differently by the mayor and the board.
Did you want to say something, Mr. Controller?
Good morning, Supervisors. Ben Rosenfield, Controller. Just to build upon Ms. Louie's statements as well, our office recommended to the Our City, Our Home Committee and to the departments that administer the fund that it would be wise to develop and implement a reserve policy for the fund this year. We did suffer a loss versus the adopted budget for the fiscal year we're winding down in excess of $30 million versus the adopted budget. And
can you explain that a little bit?
Sure. So obviously the budget for this program, which is in excess of $300 million, is based on collections of taxes paid by only 400 businesses in San Francisco. So business tax, which is always unpredictable, this tax is paid by a subset of that community. So it's very sensitive to fluctuations in gross receipts, payroll, and other things which are very unpredictable right now in particular. So the estimate that was used for last year's budget was overstated by over $30 million. So we had a loss versus that budget in the current fiscal year, which departments were able to absorb without affecting program, largely because Big C is in the early phases of its implementation. So pushing all of this money out the door has proved challenging.
So how did it go? How did it go this year, though?
No, this is the first fiscal year that we're talking about. So the fiscal year that we're now ending.
So the spending plan was based on before revenues actually came in, even though we had a reserve account that from the settlement dollars that were sitting there, it was in the hundreds of millions of dollars?
The spending plan for the current fiscal year was our forecast of revenues that we expected to come in the current fiscal year. The same is true for next year, of course. So the risk is that to the extent that there's a variance, that we have less collections than we project at the beginning of the year, that has the potential to affect programs funded within any fund in the city. Mm-hmm. So given that current year experience, given the volatility of this revenue source that we can expect over time, we've recommended to departments they develop reserve policies. Of course, the ultimate amounts of those reserves are policy choices for the mayor and the board.
Right.
But I just caution that to the extent we don't have reserves available in a very significant fund like this, and we do have revenue losses, that will back up then into the general fund or require cuts to programs in that special revenue fund.
I get it. But normally there's a range of reserve percentages.
That's correct, Supervisor. 10% has been our recommendation in reviewing the volatility in this fund. But again, that's a choice and a risk management question.
That's a choice that this body could make. Okay, that gives me the information. I think it gives all of us the information we need to make. I mean, I guess the point is if we have money sitting there and there's excessive and continued demand now, there could be some choices on reducing the percentage of that reserve, not necessarily eliminating the entire amount, which then would open up additional general fund dollars and also behavioral health needs that are happening today that are on our 1.3. Has it gone up since last night?
It keeps growing every day.
Okay. Well, $1.3 billion in requests coming to this committee. Did you want to say something, Director Grafenberg?
Thanks for the opportunity to speak. Just to note that it is one-time money, so any use of that money for one-time purposes could create a cliff for those programs.
Other than a one-time use, correct. Okay, thank you for pointing that out. And then the facilities maintenance fund, can you tell me about that, $4 million?
Thank you, Supervisor Greg Wagner again. The facilities maintenance is related to our program to acquire sites for the Prop C program. And we're doing this in many ways in a different way than the department has historically. But as you are familiar with, the Prop C program has funding for acquisition of sites for beds and other services. And because those are acquired and operated within Prop C, there is no general fund allocation for maintenance and upkeep and operation of those facilities. So we're carving out dollars associated with those property acquisitions so that we have funding available to manage and maintain the sites. That would normally be done through either our general fund facilities maintenance project, if it was a general fund acquisition, or through a contract if it was a CBO acquired site. So that's our goal with that funding.
But is there identified need for that right now? Or is this potential and not necessarily identified yet?
So we have already acquired a site at Geary and I'm going to get the cross street wrong. We also are about to open the Somerize drug sobering location, and we are in the process right now with letters of intent to acquire additional facilities to.
So this would be
operate beds.
This would be maintenance and operate. Got it.
Exactly.
Okay, that makes sense.
To make sure
and then
that we keep up the facilities.
And then the last one is the site acquisition of service center for $7 million.
Yeah, so that is really about the effort and intent to identify a single point of access, which we've been calling the Mental Health Service Center, which would be a kind of a key doorway into all of the services and the coordination services that are envisioned under Mental Health SF. The purpose there is, and we are working right now with real estate at looking at a bunch of physical options, and the controller's office is in the process of doing an analysis of operating models for that site. But that's the intent there, is that it would give us some funding
Got
to
it. Okay.
acquire.
I just wanted to say that get that on the record.
Thank you.
Okay. Beyond those two, I have just two last questions. The first one is in one of our meetings, and this is on our list, we heard from concern, and this is for you, Dr. Colfax. We heard from some concerned community members that many students at SFUSD are not being screened for vision needs. Some of them don't have that initially in their plan. So there's a proposal that has they come on to the site, they do the screening early, they identify, it helps with literacy, it helps with early reading. This is a modest request. I think it was for $600,000 or less. It's something that we'd like ask you to look at and see if there's a way you can absorb that in your budget. It has tremendous impact. I think it has measurable outcomes in terms of children's performance in school, and it's something that I think for a very small amount would go a long way from your department helping the sport. So I'm happy to have my office follow up with you all and see if between now and next week you all can absorb that in your budget.
Thank you for that. I hear the concern and hear that it's a priority, and we'll certainly welcome conversations to see what we can do there.
Great. And then lastly, in terms of the MINA project that we just cut the ribbon on, I just wanted to ask Dr. Kunins, and we had this in our meeting, if you could come up for a moment. Just we didn't really get a clear answer on how many. And I know you're going to tell me that there's a continuum and abstinence. This is my abstinence. I have to ask my abstinence question. We had the questions before about the TRP, which is not funded, but it's ADP, adult probation. It's an abstinence, 100% abstinence environment. And then we did the MINA project, which I think is on that continuum. How many options or how many other beds are abstinence focused in this budget, or that you plan to? And I know that that's the ultimate goal, and I know that's what you're going to tell me, and I'm not trying to have the debate about harm reduction and abstinence, but just want to know from our previous conversations, there's a universe of providers out there not necessarily under contract with DPH, so just want to get an update on the number of abstinence-based beds that we have.
Thanks for the question, Supervisor. And good morning, everyone. Dr. Hillary Kunins, Behavioral Health Director.
I'm sorry I said your name wrong, Kunins.
That's okay.
Sorry, no, my name gets said wrong all the time, so I want to say it right.
So I very much appreciate the question and our ongoing engagement in this really important issue. The majority of the new beds and facilities that are slated to open in this remaining year are places that offer formal treatment, and I think with the stated goal of helping people in their recovery and with abstinence being a key part of that. A lot of the beds that are slated to open this year actually include very specifically mental health treatment. And so a lot of the conversation that you and I have been having is kind of language and approach specific, I would say, to substance use treatment. The approach here is really to be able to treat people with both mental health and substance use needs using formal and effective scientific treatment. So the lower threshold service that's opening soon, as you just heard from Mr. Wagner is Soma Rise, and I would describe that as on the harm reduction end of that spectrum. It is not offering formal treatment. It is supporting people who might be intoxicated in the moment, meeting their needs at the moment, continuing to engage and link them to formal treatment. The remaining beds are longer term residential care and treatment, including rehabilitative board and care, including expanded MINA beds, as we just discussed, which very much will be, as you noted, operated by Westside with their partner TRP. We are anticipating offering wraparound formal treatment and support at that longer-term site.
Okay, great. And we look forward to continuing to work with you on expanding options similar to the MINA project. Thank you, Madam Chair.
Thank you, Supervisor Safai. Supervisor Chan? Thank you, Madam Chair. And my question, I want to share the sentiment as Chair Ronan has expressed about your hiring process and the improvements and seeing that great improvement. So we really appreciate the effort. And with that said, and it's also very pleasing to know that our HR department has done a wonderful job with our registered nurses with the MOU. And so again, congratulations to everyone involved in having that success. Really glad that we're improving that MOU and moving things forward. I do have a question though with that, knowing that all the success and the success to come, and when it comes to hiring, especially when it comes to the registered nurses, in March or in February, you came forward with the cross-country contract, the cross-country staffing contract specifically for as needed registry personnel. I think that's really mainly the nurses, and for increasing the contract dollar amount from over 59 million to over 85 million, which is about almost close to $30 million of increase. That is for till June 2024. So just kind of wondering if there is room for that, dollar amount now that you are with the success of HR process, and we have that MOU now in place, which I believe with the MOU is also the increase of hiring of registered nurses. Is there